Welcome to episode 46 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're focusing on skeletal muscle and respiratory pumps. These are two crucial mechanisms that aid venous return and help maintain cardiac output. Since veins operate under low pressure, these pumps play a vital role in ensuring blood efficiently returns to the heart, especially when you're standing or exercising. By the end of this episode, you'll understand how these pumps work, why they're important, and how they adapt to different physiological conditions. So let's get started. Now, as you recall, venous return refers to the amount of blood returning to the heart. There are multiple factors that influence venous return, including blood volume, vein resistance, and the phase of the respiratory cycle. However, because veins are low-pressure vessels, blood must fight against gravity, particularly when in an upright position. This gravitational effect creates a taller column of blood, leading to pooling in the lower extremities and reducing venous return. Now, to be clear, the blood is moving, but it's moving much slower. Now, to counteract this, the skeletal muscle pump and respiratory pumps help push blood back to the heart, ensuring proper circulation. So let's talk about the skeletal muscle pump first. The skeletal muscle pump prevents blood pooling in the lower extremities by using muscle contractions to compress veins, which propels blood toward the heart. When skeletal muscles contract, they increase pressure on veins and force blood upward. Valves within the veins open to allow forward flow, but they prevent backflow. When muscles relax, these valves close, stopping blood from moving back down towards your toes. Repeated muscle contractions during exercise significantly enhance venous return and help maintain cardiac output. An easy way to visualize this is to think of squeezing a tube of Go-Gurt. The applied pressure pushes contents upward, while a one-way seal prevents them from flowing back down. Now, breathing also influences venous return through the respiratory pump. During respiration, pressure differences between the thoracic and abdominal cavities create a pressure gradient that assists venous flow. During inhalation, venous return actually increases. The diaphragm contracts and moves downward, which increases thoracic volume and decreases thoracic pressure. Meanwhile, abdominal pressure rises, which creates a pressure gradient that pushes blood from the abdomen into the thoracic veins and toward the right atrium. More blood flows into the right ventricle, which increases pulmonary blood volume. However, this expansion of pulmonary capillaries temporarily reduces left atrial filling, which causes a slight decrease in left ventricular stroke volume and consequently in mean arterial pressure. Then we have exhalation, where venous return decreases to the right side but increases to the left side of the heart. In this case, the diaphragm relaxes, which reduces thoracic volume but increases thoracic pressure. So the pressure gradient reverses, causing less blood to flow into the right atrium. At the same time, blood is squeezed out of the lungs and increases left atrial filling and left ventricular stroke volume. This will also lead to an increase in mean arterial pressure. Now, during exercise, venous return must increase to match the demands of increased cardiac output. This is accomplished in three ways. First, there are more frequent skeletal muscle contractions, which increase the activity of the skeletal muscle pump. Increased breathing rate and depth enhances the respiratory pump's effectiveness. And then finally, there's higher sympathetic activity, which causes venoconstriction, or constriction of the veins. This reduces venous compliance and helps push blood toward the heart. So let's summarize with 5 key takeaways. First, the skeletal muscle pump propels venous blood toward the heart through muscle contractions and is aided by venous valves that prevent backflow. The respiratory pump influences venous return via changes in thoracic and abdominal pressure during breathing. During inhalation, right atrial filling increases while left atrial filling decreases due to pulmonary capillary expansion. In other words, remember, the pulmonary capillaries will expand to take more blood, or we're filling up more of those pulmonary capillaries. Next, during exhalation, right atrial filling decreases while left atrial filling increases as blood moves out of the lungs. Finally, exercise enhances venous return through increased muscle contractions, deeper breathing, and venoconstriction. So that's it for episode 46 of the Pulse of Physiology. I hope this episode has helped clarify how the skeletal, muscle, and respiratory pumps support venous return and circulation. Join me next time for episode 47, where we'll explore blood typing and its importance in transfusions and immune compatibility. Until then, keep questioning, keep exploring, and stay curious.